Good morning. I'm not using your name because I want to maybe show this case to some patients without your name being listed or mentioned because it's just fantastic the job you did. And I'll get into some specifics. I remember you were concerned because you do a lot of speaking, you're on television, and you were worried whether you could wear the aligners enough. And you clearly did because it speaks in the results. Let me walk you through what we accomplished. And by the way, as you recall, we use no attachments on your teeth whatsoever. I always try to avoid them when I can. So if you look at your lower teeth, here's how you started and here's where you are now. So this is very common, even in almost best case scenario, that there's a little bit of work to be done. My skill is devising the sequence of movement that we use to make these teeth straight. And your job was to wear them really well, which you did. And yet still at the end of 6 months of aligners, you can see how this tooth is just still a little bit out. This one's still a little bit in. This one's still a little bit in. Every tooth is sort of just has a remnant of the former position. So if you see I go like this, that should be able to line them up. And it looks like we'd have 9 aligners left for that. In terms of the heights of the teeth, I want to try to bring them down a little bit because I want your deep bite to be improved. So what that means is here's where you are now, here's where you started. So we like to see more lower teeth. And that's just because it's not about the visual or the cosmetics, but I want your lower teeth not to be biting so hard against the upper teeth. What I can't accomplish, I don't think, is getting them all totally level. So you see how this is taller, this is taller. Now, this does show maybe the best possible leveling, but it might be tough. In other words, this one might remain shorter, and we can polish the edges of these teeth when you finish the treatment. So I don't have to move any of these lower side teeth. They look good. Let's move to the top. So on the top, you had this tooth sticking out, rotated out, and this one in. And you can see that is really close. The upper, you almost nailed it. In fact, I think the only teeth that need to be moved, you can see here, is just those front 2 teeth kind of finishing out that rotation, and maybe this tooth coming out a little bit. That's it. So I think we'll be done at about the 9-month mark. No attachments were needed. Great cooperation. Let me know if you have any other questions or concerns or things you see that I don't see. And I want to point out one other thing, because this is really common. On the bottom, we both acknowledge that there's still work to be done, just in terms of this basic alignment of this tooth right here. Sometimes when we've accomplished so much and then we get another round of aligners and then the patient isn't able to make it perfect, sometimes there's limits to what we can do. So obviously we should, in theory, have no problem getting it from here to here in terms of the alignment. You'll need to continue your great cooperation. Some patients get a little overconfident and they already like how their teeth are looking and they don't wear it as much. And that's one of the reasons that it's hard sometimes to make it as perfect as possible. So we'll see. My point is that you've had 6 months of treatment now to go from here to here. And there are times when it could take another 6 months, and it shouldn't, to go from here to here. And sometimes patients just are unreasonable in their expectations. So I don't want to put a downer on this. I believe that we're going to be able to get it looking great with your great cooperation, and we'll take it one step at a time. Let me know if you have any questions.